Hello, everyone. My name is Candy Marie, and I'm excited to be back with Dr. Andrew Jones for another COVID-19 podcast. So, the last time we talked, we had an amazing conversation.
We did.
All things COVID, and we're back here today.
Yeah, a lot of stuff's happened since then. So
a lot has happened. And one of those things that's happened is you actually contracted COVID yourself.
Surprise. I mean, I'm a physician, so I've dealt with hundreds of COVID cases since January. So I knew I was going to get it. So when I got it, I was just glad to get it out of the way. I knew I was going to get it. So.
Do you feel like you took the proper precautions as much as you could to prevent yourself from getting it?
You know, I did, but as not just a physician, as a microbiologist, I know how this thing spreads. So I knew that me wearing all the protective equipment, the masks, the face shields, the covers, the gowns, it reduced my risk, but it didn't negate it 100%. Mm-hmm. So when I got it, I didn't even know I had it. So when all these policies in the hospital, check your temperature, do you have like these 3 symptoms, shortness of breath, fevers.
You didn't have any of that.
Dry cough. I had none of that. So I'm going into the hospital, talking to people, and spreading it, and they let me work, and I didn't know. It wasn't until later on, and I cover this more detail in my video, but later on I realized that something's not right here.
So I'm losing weight. That thing? So you were losing weight. That was the first thing.
I was not eating. I thought it was a combination of I'm working day shifts, night shifts, I'm in the hospital, I'm taking care of patients, I'm stressed out, I'm worried about this person's crashing, I gotta get the right dose of medication. I'm just all over the place, so I thought it was a combination of my adrenaline and stress and not eating, but Then 2 weeks later, I got really dizzy. I was in the hospital seeing patients. I saw in the hospital, and then I got up to go get some lunch, and I felt this black shield come over my eyes. And I almost passed out. I said, something's not right. I haven't been eating, and I'm not making any urine. So I'm definitely dehydrated. I know there's some electrolyte imbalances. Something's going on. So I went downstairs to the emergency room, and long story short, I said, hey guys, I need some help. Something's wrong with me. They said, well, what do you mean? I told them everything. They said, well, what do you think you have? And I'm like, guys, the doctor. But then, they looked at it. So I said, well, honestly, the only thing I can think of is COVID, some GI symptoms and stuff. So they gave me some IV fluids, 4 liters actually. It took 4 liters of fluid for me to start making urine. So 4 liters of fluid, and they tested me, I was positive. And then I felt a lot better actually. I was able to drink on my own. And my urine went from being a dark color, amber color, to light yellow to clear.
Wow. Okay, so when did your body stop, I guess, creating urine? Because that's scary.
I know, but I didn't know, because you gotta realize I'm overworked. I'm doing a lot of things. I'm in the hospital day shift, night shift. I'm doing the clinic. Yeah. I'm pushing my body to the limit, doing so forth, and trying to help as many people as I can, which is not good. Stress is one of the things that actually weakens your immune system. Mm-hmm. So I was not taking my own advice about reducing stress. So but I was one of the fortunate ones that did not have the severe symptoms. Mm-hmm. And I pulled through, and I was actually pretty good, for a while.
So what did you do to, I guess, get over COVID? I mean, that's the thing we all want to know when we get it. How do you keep yourself safe?
It's an interesting question, because what do you do to get over COVID? You just let your body get rid of it. And it's the same thing with COVID. COVID affects people. Some people have no symptoms. Mm-hmm. Some people have mild symptoms. Some people have moderate symptoms, severe symptoms. Some people end up in ICU. Right. So it's a long range. So there's no such thing as COVID symptoms. Right. I mean, I had COVID, but I didn't have the COVID symptoms, and I'm in the hospital working. So it's. I was fortunate. So I'm happy to be here to do another episode.
I'm happy to see you. You look great.
Yeah, thank you.
But I mean, like you said, you didn't have the symptoms, so.
No.
First thought I had was, okay, I hope he is completely cleared of COVID, because.
I went and got the antibody test. I donated blood at the Red Cross, and they offer antibody testing also. Okay. Donating blood actually does your body really good, because your body has to remake everything brand new. Mm-hmm. So actually there's a lot of health benefits to donating blood, but we can talk about that another time. Okay. But so I tested positive, so that immunity, actually, so I'm immune. So the question is, how long am I immune for?
I don't know, doctor, how long?
So that's the million dollar question, because it's so interesting, because people will say, Dr. Jones, how can people get reinfected again?
Mm-hmm.
Like what happens to the antibodies? Like this person had antibodies and then later on they got COVID again and it got worse. Like what's going on? Like why is there all this disparity? Like what's going on?
It doesn't make sense. I'm sure a lot of Americans have so many questions about COVID because there's so many strands, there's so many things that are inconsistent that we're receiving from the media.
And I'm not that my title as a physician allows me ability to speak on that, but as my training as a molecular microbiologist and immunologist, and also be doing the research in the labs as a research scientist and so forth for years, is the reason I'm qualified to speak on this topic. There's a lot of smart people in this world who do well at what they do, but they're not qualified to talk about different things.
But that's interesting that you say that, because it's like to have so many smart scientists and people that are researching and doing the work to find a cure for COVID, we still don't have one. You know, and people have antibodies just like yourself, but they continue to get sick. So the people want to know, like, what exactly do we do? Because everybody has answers, but nothing's being solved.
Nothing's being solved because you have smart people going outside of their lane making decisions in areas that they don't know anything about. You have people on TV who are top cardiologists, top neurosurgeons, infectious disease doctor, but they don't know the virology, microbiology, epidemiology of this disease. So you hear them come on TV and say something that, oh, we recently discovered that Dr. Fauci said, there's actually a recent article, he said, we recently discovered that the virus is stable at 40 degrees Celsius. This virus can be aerosolized. It can stay on your face mask for a week. So when people like adjust their face mask, they're actually, and then to eat or drink, then they touch their cell phone and everything. That's one way you're transmitting the virus, and people don't think about it. They're like, my face mask, my face mask. That's all they focus on, my face mask, but they're contaminating everything. And also that the virus can stay in the air for hours. It can stay on surface for a week. These are things that if you went to him as an infectious disease doctor, very bright guy. Like I've listened to him for years. He's smart, very smart guy. Not to take anything, but when you step outside of your lane, then things that to you are new are not new to that virologist at Harvard or that microbiologist at some community college in another state. Like that's not new to them. They know that they've written papers on coronavirus. They've written papers on MERS, SARS. They know all this very well. In other countries who have no cases, they've employed those experts, and that's why they're living their lives with no cases, like South Korea, Australia, New Zealand, no cases, they're happy,
but
and we're struggling.
What they did, though, is they started early.
They did.
And unlike a lot of the states here in the United States, we have not taken this virus seriously. The simple fact that New York once had the highest amount of cases, they now have some of the least amount of numbers compared to a lot of states such as California and Georgia and Florida. I think the problem is that people aren't staying indoors, they're not isolating, they're not quarantining, and it shows as a result of that. Their hospital numbers are much higher, and that brings me to my next question. What are the hospitals like today that you've experienced? I mean, when you're on the floor, you know, is it as packed as it was when this virus first came out?
It's not as packed because every winter, every healthcare professional, you know, in the hospital knows we dread the winter time because we know the hospital's gonna be packed in the emergency room, the hallways, the bed's gonna be packed, the ambulance is gonna be on diversion, which means they go to a different hospital. It's gonna be chaos. That's 200 respiratory viruses in COVID. Influenza. But add COVID on top of that this winter, there's no way we can treat COVID patients on top of an over-stressed out healthcare system. It's impossible. You know, the ventilators are packed, like the oxygen tanks, the treatments, the doctors are overworked, we have too many patients, the nurses are stressed out, the respiratory therapists trying to give treatments to everyone, like everyone is stressed out during the wintertime because we're overworked. And then to have COVID patients on top of that, there's no way.
Okay, so let's just be direct, okay? Let's just get straight to the point.
Wow, okay, all right.
All right.
Okay.
As we're gearing up for the fall, because the winter and the fall is still here, we're at the very end of the summer. What do you recommend that the people do? Because there is still time to kind of slow some things down before this big impact of phase 2 happens. Honestly, let's not hold back, straight to the point. What do you recommend that people do?
The face mask, the social distancing, the washing your hands are great, but that's no substitute for a good night's sleep, a healthy weight, and exercising. you get more benefit from doing that than you do from those three things. In the beginning, the expert said, and I agreed, I said this in the beginning also, my first podcast, trying to stop COVID is like trying to stop the wind. But let's just have everybody do the social distancing, face masks, and so forth, so that we don't overwhelm the hospital systems.
Right.
So that we have our patients in the hospital, we're treating them. You know, the doctors, nurses, everyone, respiratory therapists can take their time and treat everyone the right way. They leave, and they get better. Then you have the other people who get exposed and come to the hospital. We treat them, we do what's right, we're not overworked, we're not running around scrambling, and then they leave, then the next people. So as this COVID is spreading through the nation slowly, the idea was, in the beginning was, let's just treat everyone and then, hey, it's gonna go over, and we'll be done, and we'll be back to normal.
But technically you can't treat everybody the same because only a handful of people are considered contagious.
That makes it more complicated. So,
and who are these people that are contagious?
So we found that 40-50% of people don't show any symptoms at all.
Right.
Like I've seen a ton of patients who have no symptoms at all. They tested positive, they're fine. They're in the hospital for different things. Like they sprain their neck, and the doctor wants to make sure they don't have meningitis, and they go home next day after negative imaging, things like that. So they're the ones, and looking at the history and all the articles I've read on immunology, it looks like there's some cross-reactivity in your immune system, in those 40-50%, that they have antibodies for prior COVID prior coronavirus infections, that the body's been exposed to with antibodies, and that partial protectivity is keeping them from developing symptoms.
Okay.
That's what we're finding out. So that's why those people have no symptoms, because as soon as they're exposed to COVID, it gets into the respiratory system, their antibodies ramp up and get rid of it. So,
right.
And they don't exhibit any symptoms.
Well, technically, we're hearing that the numbers have been a farce.
The numbers have been, and even the CDC wrote an article over a month ago saying that these numbers don't make any sense. You know, like there's a lot of false positives. The quality of the tests in the beginning, they didn't make any sense. We had a lack of FDA tests, and the tests that they were approved were faulty. They didn't work, so we were lagging behind. So while this virus was spreading, we were playing catch up. We were trying to scramble, you know, and we're paying the price.
Yeah.
And when I say we, the American people are paying the price.
Yeah, absolutely.
So,
absolutely.
yeah.
Yeah, it's such an interesting time because it's like, who do you trust? You know, we're hearing about all of these new treatments left and right. You know, we're hearing false information from the media. Dr. Fauci has given his information. People are fact checking him, and it's coming off as if the information that he's giving is inaccurate as well. You know, not to mention the numbers are being sent directly to Trump. So it's like, who exactly do we trust?
Yeah.
Now, because I'm sitting here with a professional and I trust you, we want the people to see your credibility as well. So you said lots of sleep, eating right. What other treatments do you recommend for COVID?
So
what makes sense to you?
So the thing with COVID is you don't know if you have it unless you get tested. It's impossible. There's no such thing as, oh, you have COVID. There's no way to know unless you get tested. Because I didn't know I had it until I had tested. Because I didn't have a fever, shortness of breath. None of those symptoms. And actually, so it's ironic. So the symptoms can be broad. There's like so many symptoms it could be that now they have like a long list of symptoms: congestion, sneezing, scratchy throat.
Breathing.
Like it's ridiculous. A lot of surgical centers, like one of my friends took his mom to get a colonoscopy, and they said, "Do you have any of these symptoms?" And he said, and her mom said, "Well, I feel a little congested in the morning," and they had to go for additional screening because she felt a little congested in the morning. She has allergies. So she was a COVID rule out. It was I don't know, we're just.
It's just interesting because there are so many different strains. So it's like, how can we really say what the symptoms are? Because it just seems like it's always evolving. Just like with children, you know, there was a point in time when, you know, when this virus first came out, that we thought that it was only affecting older people. And then I think it was a few months ago when we heard that it was affecting children.
Okay.
And younger children were
So
affected.
here's the ironic thing. When everything started in December, and 10 days later they had sequenced the SARS coronavirus 2. And they announced it, like this is 80% similar to SARS from 2002. Once they made that announcement in early January, countries around the world took that information and either ran with it, like New Zealand, South Korea, and so forth, and said, okay, wow, this is a respiratory virus, which means we're gonna have an incubation period. We're gonna have asymptomatic cases. It's a respiratory virus, so it can be spread in the air. Some people are gonna have mild symptoms, none. So we need to like shut down the airports, face masks, get the testing. So they're experts. They're people who are experts, got in charge and said, okay, we need to make sure it doesn't get into our country. They did everything in the beginning. And all the literature, if you look at the literature, it says to stop a pandemic, you have to do those things in the beginning. We didn't do that. So trying to do that now is like trying to evacuate people from a California wildfire when the fire is outside. It's too late. You're stuck.
But I believe the reason why we did not do that is because if this country is in a state of emergency, therefore we can't bring in another president. So I think that there are different theories and reasons as to why we haven't controlled this pandemic. For us to be the strongest country on the face of the planet, we're smart, you know, we have great professionals that know what they're doing, but for some reason, it still has not been contained. You know, President Trump left a lot of those decisions up to the governors of their states, and they haven't been properly governing their states. So I guess my question to you is we've clearly seen what these other countries are doing right, that we're doing wrong. What's your view on what I just said?
So politics and science are two separate things, so I try not to get into that. But what's been done wrong is actually, believe it or not, similar to what happened in 1918 with
the flu pandemic.
The flu pandemic, yeah. So it was pretty bad back then, 17, 18. There was first wave, the second wave, the third wave. It was really bad. People were dying. They were wearing face masks back then. There was social distancing back then. The government said, don't worry, this is just a regular flu. It's going to pass. Focus on the war, World War I. Let's focus on that. We'll get over this. And then the people began to develop distrust in their government. They were frustrated. They just didn't believe anything. And there's actually books out about what happened back then, you know.
Yeah, it's such an interesting time because when I think about when we had a lot of people protesting and there were so many clusters of people that were in the same area where I can just reach out and touch you, I literally protested at least maybe 5 or 6 different times. And I got tested. I just knew I had COVID. Technically I had to have had COVID,
because
even though I had a mask on and
yeah.
I was around so many different people. I tested negative. So that just raises so many questions to me. You know, how is it that some people are asymptomatic and others aren't? Is it based on blood type? Is it based on DNA?
Yeah. So we're finding some interesting things. First, we're finding out that men are more susceptible than women to getting COVID. Two, if you have an O positive blood type, you're less likely to have severe symptoms. So everyone out there with O positive blood type, count your blessings.
Okay, and that's interesting because I think initially I heard that A blood type was more susceptible to the virus.
No, they aren't. O positive means you're in a good position. You're less likely to develop severe. But A, you're right. A is the worst one.
Okay, does that mean that O has like a stronger like blood type?
There's some
what does that mean?
There's some immunology factors that go along with that allow you to be protected with O positive blood type. So everyone O positive blood type, you're good. So.
Okay, well.
And then so that we're finding out, and then so women are protected more than men. The O positive blood type. We're also finding out that, believe it or not, kids are not spreading the virus like we thought they were. So a lot of politicians and so forth are advocating, okay, let's open the schools back.
Are we really sure about that?
Yeah, we are, because we're finding out that people, and we're also finding out that people are more so getting COVID when they're at home. Because think about this, you're out and about, no matter how you are with one face mask or N95 surgical mask cloth, you're diligent about what you're doing.
Right.
You know, you wear your gloves and so forth. But when you get home, what are you doing? Everything you touch while you're out, your cell phones, your purse, your car, you take your face mask off. And then you take your face mask off. Your face mask has a ton of viral particles on it because you're touching it, you're going through, walking and so forth. So your virus is in the air. So you're going to the bank, the post office, the store, like everywhere you go, you're exposed. So you touch your mask and everything, and that's one way to get it.
Right.
So
well, my concern, going back to the children, and I'm also going to pose a quote to you to get your feedback on as well.
Sure.
But just going back to the children, you know, we're releasing these kids back into the schools. I think, I think in the state of Georgia, recently. I think after the first day of the kids going back to school, I think at least 9 students tested positive for COVID.
Mm-hmm.
So with that being said, most children, I feel, and just based off of the conversation that we just had, seem as if they're asymptomatic, right?
They are, yeah.
They expose each other to the virus, then they come home to their parents, they pass it on to their parents or their grandparents, which leaves their parents and grandparents, of course, initially not knowing that they have it, passing it on to other people. So I don't think that this is the smartest thing to do at this time until this virus is contained.
Well, we found out that kids are not as contagious as we thought. A lot of studies are coming out to say that, oh, kids are not the harbingers of the virus like we thought. We initially thought, okay, we're not worried about kids because kids, they get the virus, they don't even know, parents don't even know their kids have had COVID. Like, they have mild or no symptoms. Sometimes they'll go to the hospital with a fever. Parents get worried, like, oh, my 2-year-old has a fever.
But what if the parent gets it from the child?
It's possible we're finding out that that's not the most common case of the parent getting the virus.
Okay.
So, but yeah, in the beginning, we thought, okay, well, you know what, the kids are spreading it to mom, dad, grandfather, grandmother, aunt, uncle, so forth, the ones with dialysis and so forth.
Yeah.
We're finding out that's not the case. We're also finding out that kids have mild symptoms. There's so many kids that will go to the hospital, like urgent care or something, they have a fever for 1 day. They're COVID positive. They may be a little under the weather. The next day they're running, playing, no fever, like that quick. Like, kids are good.
Okay.
Like,
well, the good thing about the kids going back to school is that, as we know, there's so many children that aren't eating properly at home. So a lot of them rely on going to school for their meals.
That's actually a sad, and this actually makes me sad and breaks my heart because schools are not just, you go to school, you play, you interact, you come home, do your homework. A lot of kids, they get their meals from school. They depend on that. Parents depend on the kids being in school so they can work because they can't afford a babysitter. 1 in 5 kids is going to go hungry, the mothers are saying, because they're not getting the school lunches. A lot of healthcare assisted programs at school have been shut down completely. A lot of kids with learning disabilities who depend on in-person interactions to learn, like, they can't get the learning from the computer or so forth.
It's a different experience.
It's different. For somebody with learning disability, they need that interpersonal reaction. And also 1 in 5 cases of child abuse is actually caught in school. Actually, so.
Interesting.
Yeah.
Interesting, because I know I'm just reading here, looking at the facts that you provided, more than 20 million children rely on school breakfast.
They do. It's a lot,
1 in 5 mothers say children are going hungry. Millions of children lost access to health services through school-based health centers. Some children are falling behind academically, which makes tons of sense because a lot of the parents don't even know how to properly, educate their kids. They're not provided with the right resources. But there are a lot of online school programs and homeschooling programs that I know that are being created and being
I like I said, it breaks my heart, and because kids are suffering because of what adults in charge are doing. And kids are innocent. Kids want to be out playing, so forth. They don't deserve to be in this situation. They really don't. They don't deserve this. And
not to mention, kids are directly impacted if their family, if their mother or father are unemployed. So 45 million people in the U.S. have filed for unemployment.
Yeah, they have. Like, this is just.
Which also means they don't have health insurance.
Yeah, they don't have health insurance. So a lot of people with the insurance and so forth, when they file for unemployment and they lose their health insurance, they have to get Medicaid. They have to get Medicaid, and it's not the same as one of the top insurances, so they don't get the same quality of health care as. So
which creates stress.
Yeah,
I feel like this is just so much. It creates stress, but what also creates an unhealthy body.
It does, and like I said, let's talk about something else. Because the kids, they're just innocent. They don't deserve this at all. They really don't. They don't deserve this. But yeah, it does create a lot of stress, and speaking of stress, is on the rise. There's anxiety, depression is on the rise by 30%. We don't have the numbers yet for any suicides or things like that. We don't have those numbers yet, but we know this is a very trying time, and stress actually lowers your immune system. We're finding out that there's a 30% increase in anxiety and depression. And whenever someone's depressed, depending on how depressed they are, it can lead to more, suicide, things like that. We don't have those numbers yet, though.
Yeah, we don't have the numbers, but just to think about, like we said, the number of Americans that are unemployed, not to mention they're holding on to our relief. What is that government doing?
The second bill.
They've lowered
Yeah.
our unemployment. It's gone from $600 additionally to now $400.
Yeah, I saw that, yeah.
So it's just like, there are countries like Canada that give their residents $2,000 a month, and we've only received one check.
Yeah.
How are people supposed to survive?
They can't, and all of this bothers me. Even though I know the science very well and I can verify everything I'm telling you, the social impact on the kids and everyone I see when I'm in a clinic. I have people crying, they're depressed, they don't know what to do, they're unemployed, they haven't worked, they don't feel validated, they don't feel like they're worth anything.
Yeah.
So I see that in the clinic, in the hospital. It's taking an impact on everyone.
And one of the things about being a doctor is that a lot of doctors instill hope into people, So I just like for you to take a second and just to talk to the viewer for a second, right? And what kind of hope can you give them? Because we need to hear, sometimes we got to hear it from people like you. Especially at a time when COVID is running rampant and people are unemployed. What kind of hope can you give?
The hope I can tell people is that this is a time that we need to take a step back by the things that distract us, our jobs and so forth, and everything that's a distraction in this country. People, it's so easily, people go home, they work, they call in their routine, so forth and so forth. With the kids and everything, it's a time to get back and look at the basics, like, okay, let me make my family more solid, unified. Let me take the free time I have to work on my health, make better choices, because health is such a sensitive topic in this country. I've had patients come to my office literally and say, Dr. Jones, I didn't come here to talk about my weight. I'm like, where do you think you are? And I tell patients, look, I'm not here to judge you. On the outside, you're a beautiful person. I'm here to talk about how the cholesterol, the triglycerides are soaking up your liver, your spleen, kidneys, and intestines and keeping them from functioning properly.
Right.
I'm there to talk about how the plaques in your arteries are building up and getting narrower and narrower, and one day you're gonna just walk and then have a stroke and end up in the hospital with the right side of your body paralyzed. I'm to talk about that. I'm not to talk about your outer appearance. That's not me. I'm not judging you. I'm not society that, looks at what kind of clothes you wear, how your hair is done, skin color. That's not me. And speaking of skin color, they asked Dr. Fauci a very controversial question, and I was actually impressed with what he said, because a lot of white people would not have answered this question, and we did not agree with 100%. They asked him, why are minorities and blacks impacted by COVID and having higher numbers of severe infections as opposed to everyone else and dying? And he hit the nail on the head, and I'm glad he did that, because what he said was true. You're not taking care of yourself, you're not eating right, you're ignoring what the doctor says, you're not following what they said, not taking the medications, and also that part can be helped. The other part about being essential workers, we have to go to work and so forth, that you can't help. Being in close quarters in bad neighborhoods and stuff, and you can't help that part.
Right.
But everything else can be helped.
Right.
Yeah.
And I'm so glad that you kind of let your hair down a little bit. Because again, I do think that that's what the people need to hear. They need to hear the truth. Everybody's looking for truth. They're looking for a piece of hope. And for you to say those words, those encouraging words, that was very important, especially for people that look like us.
Yeah, definitely.
Because a lot of our health issues, they start from way back from before we were here. I think it's generational.
Yeah.
So healthy eating is something that we can start to build those habits now. It starts with teaching your children at home, and I'm glad that you said it starts with spending time with your family. And some of those conversations that need to be had in these households is how to eat properly.
Yeah, we don't have them, and if we keep ignoring the problem, so people say oh, well, that person's healthy, and so let me say this about being healthy. If you came to my clinic any day and you looked in the waiting room, you're gonna see people a little overweight, a lot overweight, look normal. People you see in the store and everything, and you're like, okay, that person, there's nothing wrong with that person. But if you were with me in the examination room, you would see this person is on dialysis. They have a arteriovenous fistula and are in dialysis 3 times a week. You see that the sugar is 600. They have eye problems, they're losing their eyesight. Their kidney numbers are going through the roof. You will see a lot of things that show that they're not healthy. So we have this blinded perception of what healthy is. You know, there's people that look like me, you, and everyone else who are healthy, who look healthy, they're not.
Right.
You know, they're not. So when I'm in the hospital and I see all these COVID cases, so the numbers of COVID cases is going up because the virus is spreading.
Yes.
The virus is here, and the numbers are going up, not because, I just want to say this to people, the numbers are going up not because the rioters, the protesters, the people who occasionally don't wear a mask or not. It's going up because the virus is here. It's everywhere. You touch here, your face mask and so forth. We live in a country where everyone is doing what they want. You know, like we're the home of the brave, land of the free, so something like that. So we are doing what we want. And this business says, okay, we're gonna do this. This business says, I'm gonna do this. I'm gonna allow 25% people to come in and eat and block out the tables. I'm gonna put a line here, and a line here. You stay here and then move up, you're good. It's like any virologist or microbiologist will look at this and just shaking their head.
Right.
Because these things, yes, the face mask and so forth, aside from that, I was in the airport the other day and walking by through the terminal, there's a restaurant and there's like tables on the lanes going to the planes. People were eating with no face masks. But me, because the table's right here, me walking by, I had to wear a face mask. But if I moved 1 foot over and sat down and ate, I could take the face mask off.
So what's your take on that?
My take on that is it doesn't make any sense.
So how do people eat with face masks on?
That's the thing, you're exposed. That's what I'm telling you, why the numbers keep going up. Because the virus is spreading, there's more people getting it. So if you go from 1 case to 2 cases to 4 cases, the number doubles. Like the factor for COVID is like 1.7, like say 2, round it up. So every 1 and 2 to 4 to 8. So the countries who did everything in the beginning, that it's easy to like 1, 2, 4, 8 cases. It's easy to isolate them and get rid of them.
Absolutely.
But when you have hundreds of thousands of people already, you know, we
How
don't
can
know.
you contain it at that point?
It's too late.
And that's why people are just going about their lives and living their lives.
There's COVID parties, there's all of this. I've had patients tell me like, oh, Dr. Jones, like a 21-year-old girl said, Dr. Jones, I'm gonna go to a party tonight. She tested positive. I'm like, I didn't hear that, and I did one of these. You know, and I said, I told you what you have, just be careful.
Wait, let's back up for a second
Yeah.
because I can't sit here and hear that and not address that. So you said that you had a patient that tested positive and she said she was gonna go to a party.
She said, Dr. Jones, I'm gonna go party. I'm thinking to myself, why would you tell me that?
Okay, now let's talk about that. I'm gonna put the iPad down for a second because this conversation has to get real. Living in California, I've heard of several parties
There's a lot of them going on.
where there are mansion parties and there are pool parties.
There's a lot of parties going on.
And people just don't care anymore. And I think that is what we have to address. I'm one of those people, I want life to go back to what it used to be.
Mm-hmm.
I really do. You know, I'm tired of sitting in the house bored. But I'm also one of those people that's gonna take the proper precautions. So can you sternly, like what would you have liked to have said to that 21-year-old? Because we're seeing it a lot within that Generation Z, millennial like age group. Being a millennial myself, I've been invited to dinners and to house parties and I'm like, did y'all forget there's a pandemic that's going on right now?
Yeah.
So sternly, what would you like to say to those people?
Dr. Fauci said that we need up to 75% herd immunity in the beginning, and that's around the average for any type of virus.
Mm-hmm.
So we're finding good news is you only need 55% of the American people to be exposed and be immune to protect everyone else. So these COVID parties and so forth, even though I don't agree with them at all, and I would say stop it, they're, believe it or not, are actually going to be our saving grace, because if you have all these hundreds and thousands of young people getting COVID, getting immune, they're going to be the ones that protect everyone else. They're going to get us to that 55% immunity a lot faster.
So you're okay with?
I'm not okay with them doing it that way, but
because I just want to be clear.
It's a blessing in disguise.
Understand what you're saying.
It's a blessing in disguise with them being exposed, getting immune, and so forth. And the immunity is going to last at least a few months, depending on how sick they were.
It's just we just don't know who is going to be immune, and that's the problem, because everybody's body doesn't carry the virus the same, and everybody doesn't get the same strain of the virus.
So let me answer that question about immunity. So people say, well, I tested positive for COVID. I tested positive for the antibodies. They're doing antibody testing like 1 week, 2 weeks later, which doesn't make any sense as an immunologist, because immunoglobulins come about 4 to 6 weeks later, because your body has to have time to make them. So why are you trying to reinvent the wheel? Ask an immunologist. You want to know about the immune system? Ask an immunologist. If I want to know about the heart, I ask a cardiologist. If I want to know about the kidneys, ask a nephrologist. I ask the people who know more than I do about that. If you are this specialty and you want to know about why the antibodies are waning, ask an immunologist. So just the basics of that. I'm not teaching an immunology class, but just the basics of that. You need a certain number of antigens or particles to get titer level to get long-term immunity. That's why vaccines take so long to develop. Phase 1 and phase 2 is, okay, what's the dose of this virus that will cause the immune system to develop lifelong immunity?
Right.
It's not just give someone the virus and they're immune. No, there's a certain number of the virus that allows them to be lifelong immune. That's phase 1 and phase 2. Then you test them on 10 people and so forth. And then phase 3 is the longest phase, which can last years, because you're doing like tens and thousands of people. You have to make sure there's no adverse drug reactions, there's no side effects, there's no heart attacks, things like that. You have to monitor them for a long time.
Right.
And in a recent article, because I know a lot of people got on me for the last podcast, they said, well, Dr. So-and-so said the vaccine should be out by this winter. And that's impossible, because in a recent article, I know everyone loves Dr. Fauci. I love him too. But he kind of backtracked. He said,
it's so controversial.
In the Journal of American Medical Association, he said his exact words were, it's going to be months and months and months before the vaccine is available. He didn't say late next year. He said months
and that's
months.
That's the safe response.
That's a safe response. Yeah, you're right. That's a safe response.
Because people are going to hold him accountable. If he says there should be a vaccine by January, people are going to say, hey, well, it's January's here. We still don't have a vaccine. What's going on?
Yeah, there's no way it can be here.
People are looking for answers and they want them, but we don't have them.
Yeah. They don't, but the immunity, I love this, because people ask me this all the time. So think about it this way.
Okay.
If you take any of your vaccines, measles, mumps, rubella, diphtheria, any of them, and you take the vaccine, you're immune. Lifelong immunity. They've done the studies, you're immune. Take that same vaccine and dilute it. Let's say you have the vaccine and you split it up, give it to 5 people. They're not going to get lifelong immunity. They're going to develop antibodies.
But they have to get, it's like getting a shot every year, basically.
Yeah.
Right? Like the flu shot.
Yeah, they're going to get antibodies, but those antibodies are going to wear off over time. Same thing with COVID-19, coronavirus. You're exposed. Your body makes antibodies. But then if you have a mild illness, it goes away. You've had severe illness, it lasts. And because we don't know how long it lasts, we found we can extrapolate the information from the coronavirus, the first one, SARS. We found that they were immune for up to 3 years. These viruses keep mutating and changing. Viruses are already mutated over 100 times, and we have 165 vaccines in development right now as we speak. 2 of them are going to start testing with 30,000 people, like phase 3, and phase 3 is the longest phase. So there's no way you can get that kind of data from 30,000 people, August at the time of this filming. There's no way you can have all the information by this winter. And then on top of that, once you have that data, you have to mass produce the vaccine. So a lot of these companies, even though the experts are saying this, like I read what they say, well, once you have this done by next year and we mass produce, we can have a billion vaccines by end of 2021 or 2022. Like, they keep pushing.
But that also leads me to another question, the
Mhm.
pharmaceutical industry,
Mhm.
right? You know, to have so many vaccines, how do we know which one's gonna work? I mean, for me, it just sounds like all of this is just business anyways. I don't really
Yeah.
feel like any of these people really give a damn about the American
Yeah.
people, like, let's be honest. It sounds like Trump is just using this for his own personal agenda.
Mhm.
It sounds like a lot of the pharmaceutical companies are doing the same. Fauci has gained a lot of popularity
Mhm.
due to this virus as well.
Mhm.
So, like, what measures do people take? What measures do businesses take to protect their businesses as well as themselves? Because, like you said previously in this conversation, people aren't really wearing face masks. So, do people wear face masks? Do they not wear face masks? Do businesses stay open? Do they close?
So, okay. So if the question you're asking me is,
Mhm.
how do we stop this virus today and now? It's, how do you stop a wildfire that's already in your neighborhood and you're stuck indoors? It's, you have to hope that that somehow the firefighters come and put it out. So the firefighters in this case would be you staying at home and letting the virus spread. You would have to literally shut this whole country down, everybody. Because even people who are essential firefighters, police, healthcare workers are still interacting and doing things. So you would have to literally have everyone stay at home for at least 2 weeks, everybody.
Well, I mean,
And that's impossible to do. That's
exactly,
impossible.
especially if we're talking about antibodies here and people becoming immune to the virus. You know, we just talked about a 21-year-old going out to party, and we're talking about her immunity and actually how that helps at 55%. If that's where we are already, we want to, I guess, reach 100%.
Yeah.
So exactly, how do we adapt? Because we're hearing so
Yeah,
much from
yeah.
so many different people.
So-
How do we adapt?
So one thing that will help us that I'm surprised no one's thought about, but they don't ask anyone else.
Mm-hmm.
You know, there's so many bright minds at all these top universities and colleges in this country. There's so many bright minds, but yet no one's asking them. And one idea is the convalescent plasma, which just means convalescent comes from not old, but there's different stages of an infection. You know, you have your incubation, your prodromal where you show symptoms, you have you get the convalescence where you get over infection. That's the last
Right.
part of infection. So that part, your body starts to make antibodies. So now they're doing donations where you have people who are donating their plasma with the antibodies to people in the hospital. It's actually working.
I was gonna say that sounds like the smartest.
It is. So if you were to mass reduce that
Mm-hmm.
and give it to your people in the nursing homes, the people on dialysis,
It's just the plasma.
it'll last 2 to 3 months.
Mm-hmm.
But it will actually, they're going to get exposed. So you might as well have them protected when they're exposed. So that is another way to get herd immunity faster also.
Wow, that's interesting. Convalescent plasma work. I
Yeah.
don't think I've heard about that, but
It's one of the
it
treatments,
just makes
yeah.
sense.
It's one of the treatments. It will help. It's not a be-all, end-all. It's not going to fix the problem,
Mhm.
but it will help. I mean, plasma is very cheap, and the pharmaceutical companies could be developed. I mean, it's not a moneymaker, to be honest.
And since we're on the topic of money making and immunity, what about COVID-19 passports?
COVID-19 passports was an idea that people said, okay, well, what about the people who got COVID?
Right.
They're immune. If they're immune, they can't spread it. So why not give them a card to say like, hey, you walk into the grocery store, look, see, I'm immune. It's not that simple because you don't know how long you need to last. Even though I tested positive for the antibodies, I don't know if I'm immune for 2 months, 4 months, I don't know. Because I don't know if I got I told you phase 1 vaccine trial is to find the right dose.
Right.
We technically do, once the vaccine comes out and we know, okay, this dose of the virus is what you need to elicit lifelong immunity, then we're gonna have the conversation on COVID-19 passports. But right now, it's too premature to talk about that. It's because you give someone the passport, then a month later, so they don't have it, so.
This is just such an interesting topic because we see healthy people die every day.
Yeah, we do.
Right?
Mhm.
So it's just, it's like, I really don't know, like, I think I sound like every other American right now, right? We really don't know what to say. It's like healthy people get it. People who are obese, people who are stressed out get it. Like anybody can get it. Nobody is safe technically or immune. I don't know. Like, let's talk about that.
We're finding out that if your BMI is above 34, you have a 6 times likelihood of being in the ICU when you catch COVID. This is not if you have diabetes, high blood pressure, or anything else. This is just by itself.
Okay.
So if you go home and you measure your BMI, which you can measure kilograms over meter squared, if it's above 34, if you get COVID, there's a 6 times likelihood that you will be in the ICU with the tube down your throat and just fighting for your life.
34%.
BMI, no, BMI of 30, you have a 6 times likelihood.
Oh, wow.
So if your BMI is above 34, which is about 60% of the country, and I've seen it too. I've seen people in their late 30s and 40s with that BMI of 34 in the ICU, but they've actually survived. There was one guy who died at the hospital. He was late 30s, who was quote unquote healthy, and they didn't understand why he died. I went with his chart. He was one of my colleagues' patients. He was overweight. He fit that BMI greater than 34. He was in ICU, had a tube down his throat. He was a truck driver. Really bad pneumonia. He wasn't eating, so he's a truck driver. He's not exercising, not eating healthy, working long hours, trying to make a living. Stress also. So all these things were lowering his immune system, along with the weight. And then he unfortunately didn't make it. So when I hear people say, "Oh, he was healthy," no, he was not healthy. And also his cholesterol was high too. When I saw the chart, so he was not healthy.
Yeah, and I think it's so easy for people to not wear masks, right? I think there's so many times where I've walked out the door and forgot to have my mask.
Yeah.
I think it's something that we have to really make a part of us. So I think it's easy to say that, there's so many things that we subconsciously do, that we touch things, like we said earlier, where we're doing these things, we have these habits, and we're not thinking, oh my God, I have to go back and wash my hands, or oh my God, I have to put some type of sanitation on. So let's talk about face mask for a second.
Okay.
Should or should not be wearing face masks?
Face masks actually have been shown that if you wear them, like I told you, face masks do not protect you 100%. But whatever particles of COVID that you're exposed to, like the surgical mask, this one right here, when you wear it, this blocks 60-70% of the air this way. But air flows on a path that leads to resistance, so it flows in through the side. So even though I'm blocking air this way, I'm still being exposed this way. So when the air comes in this way, like all the particles and stuff and so forth, I'm getting exposed to COVID. And they found that these face masks actually lower the amount of virus that you're exposed to, which means you get a mild infection. So these face masks actually are lowering the severity of people. There was actually a recent article on a cruise ship, people were scared of going cruises, that they found out that people wearing face masks on a cruise ship, even though they had COVID-19, they were not that sick. People who didn't wear the face mask were sicker than the ones without the face mask.
It's just so stressful,
Yeah.
Because again, we're getting so much information from so many different places where it just seems like nobody really knows, no offense to you, what they're talking about.
Yeah, sure.
I don't even feel healthy when I'm wearing a face mask. I really feel like the majority of us 10 years from now are going to have issues with our breathing.
It causes damage. It does cause damage when you're breathing. Some people who can't breathe and they have the face mask, and a lot of governmental policy said if you have asthma, you don't have to wear the face mask because asthma you need air. The face mask restricts your breathing.
That leaves you open to getting COVID, right?
Severe asthma. Now, I know we're all over the place.
Respiratory problems are going to make you more susceptible to COVID.
Yeah, so if you're tight chested having an asthma attack, you're high risk of COVID. The thing with, just real quick, back to kids, we're finding out, and this just shocked me, finding out that kids who have allergies or asthma actually are having mild illnesses from COVID-19. And the thought process, or hypothesis that's running among immunologists and so forth is that they have less of the ACE2 receptors in which the virus binds to in those with asthma and allergies. But we're doing more studies to confirm that. But that's what we're finding. It was shocking that, oh wow, why would a kid with allergies and asthma have less severe infections than a regular kid? So back to what you're saying with adults with asthma, is you can't breathe with it, you're sweating, you're outside running, once your face mask gets wet, it doesn't work. You know, you can't breathe. It's just.
It just sounds like a lot of us need to take our own proper precautions, which are isolate, be smart about this. I think President Obama made a really great point. Like, use common sense. Wash your hands. You know, sanitize, and stay home. Period.
Yeah, in 2016, Obama did say, guys, we need to prepare for a pandemic. You know, he said 2016 is going to come, and these viruses are all over the world. They're mutating as we're speaking. There was one kid in Chicago who caught, he survived though, he caught the flu. So they sent his sputum sample to the lab, and it was a combination of the swine flu and the flu from last year that had bound together.
Right. And
that strain they did in the lab at the CDC, I think it was CDC, the lab, found that if there was 1 or 2 mutations away from just causing havoc across the whole world and cause more mortality than COVID. So right now, as we're focused on COVID, there's other viruses around the world that are mutating. We have Marburg virus, Ebola, hantavirus, you know, so forth, that they mutate and become respiratory, then I don't want to sound dismal, but it's not going to look good at all. So we need to prepare, and it's not us, because it's everyone in power. Like other countries, it wasn't the people of those countries in South Korea that did a good job. It was the experts and the government in charge who are in power that did a good job.
Which sounds like to me a lot of people learned and prepared from their past.
They did.
So if we could just, just to wrap up this conversation, because as we can see, there's so much that we need to learn, and so there's a lot that we need to do as a people and as a country. Any last words of encouragement that you can give your viewers?
The purpose of these episodes is to educate you with information that are validated and proven. So, face mask, people say, oh, should I wear a face mask or not? Yes, wear the face mask, because even though it doesn't protect you 100%, it's like an airbag or a seatbelt. It won't keep you from dying in a car accident, but it'll increase your chances of surviving. So definitely the face mask, the hand washing, the social distancing. You're going to see things that don't make any sense. It's a tense time. We have to just somehow find a way to reduce our stress. I mean, everyone's tense, even me, believe it or not. Just a real quick story. I'm in the hospital, I'm in the cafeteria, I'm in an area where I don't have to wear a face, I'm eating. And I said, oh, I need some ketchup. So I hop up and I go get some ketchup, okay? And I come back to my seat. I finish my meal. 20 minutes later when I go upstairs, the medical director where I'm at, he's kind of like, give me a look, like, hey, I got a weird phone call from the hospital administration. I'm like, well, what's going on? He said, someone saw you in the cafeteria without a face mask and complained. So to the hospital administration called the medical director, who said, I don't want you to get stressed out, Dr. Jones, you're a great doctor, so forth. I just have to tell you, that's it, don't worry, that's gonna happen. And I was just like, wow, like, are we that tense and stressed out that we're nitpicking?
Yes, we are.
We're nitpicking every little thing, but it's okay for me to be fine here eating, but 5 feet to get some ketchup.
Right.
I was supposed to have put my face mask on, got the ketchup, come back to my seat, and that was proper protocol. And that is what people are doing, everything what they want. Is in businesses, I'm starting to see on commercials, they're trying to get people to come out and eat. They're saying, okay, well, we're gonna check your temperature, we're gonna do this, we're gonna do that. And a lot of these things have not been scientifically proven to reduce the spread of infection, like temperature screening and so forth. But you have to do something to stay afloat. So to answer your question about what business can do, so what the business can do is stop doing things based on feelings. I feel if I do this, I feel if I do this. Talk to someone who knows that.
Right.
Like if I want to cook something, I don't say I feel like if I cook it for 5 minutes or so forth. No, I'm gonna ask someone.
Right.
So
I mean, again, we hear your concerns, we see your fears, and that's why we wanted to make sure that this conversation was as blunt and to the point as possible. And I wasn't gonna hold back with my questions, because I'm pretty sure a lot of you share the same questions. So again, Dr. Jones, we appreciate your passion, we appreciate your knowledge, and we appreciate you for sharing it with your viewers. Until next time, podcast, episode 5.
Episode 4, I'm surprised it's going on this long. There's so much information that's coming out, and a lot of things are going on, and I'm pretty sure the next episode, hopefully,
Episode 5, you can
Episode
definitely
5.
check out the next one.
hopefully it's more upbeat and we have a plan. Hopefully.
You know what, I'll say this,
Yeah.
I think people just want the truth. You know, they just want the truth, and there's so many different versions of the quote unquote truth out there that we're all just trying to figure it out. So I think the pacing was great, and I think what would make people more upbeat is for a vaccine to come out. That would make me a little more upbeat.
Yeah.
So thank you for your energy,
Thanks,
thank you for
thanks.
your passion, and we want you guys to stay tuned until the next episode. Thank you for watching.
Take care, guys.
Bye.